harder than normal with that buck-up comment, expecting Congress to pass the bill this summer no matter how much it costs. My next guest says healthcare reform is indeed crucial. Democratic Congressman Diana DeGette is the vice chair of the Committee on Energy and Commerce. Congresswoman, good to have you.
Hi, Neil.
You know, it's the cost thing that's really proving staggering here. I guess it's to be expected if you want to get everybody insured, and 46 or 47 million purportedly uninsured. But this won't even do that, and you know, we're looking at taxing upper income folks, rich folks, to the tune of 5.25% to pay for something. It's getting big. Are you worried about just the sheer cost?
Yeah, you know, we have, as you said, about 47 million people in this country who don't have health insurance, and the cost of them not having health insurance, going to the emergency room when they get sick, foregoing preventative care, and on, is really crippling our economy. We have, by far, 2 times as expensive a healthcare system as any other industrialized country, and we have one of the lowest medical results in the world. So what we're trying to do is
when you say lowest medical results, when you say lowest medical results in the world, first of all, people quibble about the 47 million figure, but I'm not here to debate the figures. I am here saying this: 90% of Americans are covered, right? And the idea is to then take care of the 10% who really are not. Now, what I'm asking is whether the 90% footing that bill are going to be happier with the results. Are they?
The 90% will not be footing the bill. People who make over $350,000 will have to pay a surcharge under the House version. We don't like that a lot either, but we think that everybody deserves good health care, and we think if we get everybody into a quality health care system, then what will happen is, in the long term, we'll save money because our health care system will perform better.
Well, how do you know, though? With all due respect, Congresswoman, you know, even those big taxes on the very, very rich are going to about pay for half of this. Now, you might be right. You might get some savings. Well, you got to look at costs here because, you know, this matters. Now, if the rich and taxing the rich, you know, whatever, isn't going to get you there, or only halfway there, and you're saying that we'll pay for this with savings that will more than account for the rest, how do you know that?
Well, a lot of studies have shown that the most expensive way to provide health care is to have people going to the emergency room for their primary care. We got 47 million people doing that. And what happens is the people who are on insurance, the over 90% of Americans, like you said, who have health insurance, end up paying more for their insurance. They end up paying more for their doctors. So let me ask you, will that
90% pay less?
That 90% over time, I think, will pay less because not only will we have everybody covered, but also we're putting quality controls in place so that we can get higher quality health care in this country for a better price.
Well, you know, Congressman, I would love to see.
Have everybody in the system.
Point taken, ma'am, and I would love to see that you're right if that's the case. Here's my worry. The last president, who was a Republican, had a Medicare prescription drug program whose costs, we were told at the outset, would be about $150 million over the life of the program.
I was on the committee when they passed that bill.
You know what happened, right? You know it's more than tripled. So my point is, good intentions go sour and go pricey.
Because under that bill, Neil, under that bill, the president did not give the Secretary of HHS the authority to negotiate with the drug companies, just like private insurance companies can, or the Veterans Department, or many state governments. And so the pharmaceutical companies just kept increasing the price of drugs. In this case, we're going to have competition under an exchange.
But how do you know? Show me an example where the government has, in the end, done things more efficiently than private enterprise.
Well, I'm not saying the government is more efficient than private enterprise.
But you're saying it's going to exact cost savings. No, you're saying it's going to exact cost savings over what we're getting now.
What I'm saying is, right now, the private insurance market has a monopoly in most states. And so what I'm saying, let's let good old American competition work. Let's have an insurance exchange. Let's let people sign up, and let's have the insurance companies compete. And oh, by the way, let's throw in a public option subject to all the same rules to compete with them.
But it's not an option, right? You're telling, but ma'am, it's not an option, right? You've got a gun to some employers' heads who don't want to go along. You don't go along, there's an 8% payroll tax you're going to have to pay. That's not an option. That's a Tony Soprano threat.
Absolutely not. Small businesses are exempt from this, number one. And number two, larger businesses can buy into this exchange for their employees, and if not, they're going to pay an 8% surcharge. But that's for large businesses, and that's to help pay for getting everybody health insurance. What constitutes large? What's the difference between large and small? The small businesses right now up to $250,000 are exempt. And then there's a sliding scale up to $400,000.
All right, so you're at that point, which doesn't make you large, by the way. You're paying an 8% taxes. You don't want to go along, right?
Well, I mean, I think most of the small employers I know in my district would be ecstatic if they made $400,000 in a year.
Well, I talked to, I got to tell you, I talked to the same small business owners, and they're ecstatic, all right, but not with joy.
And most of those small businesses in my district, by the way, want to have a way to give their employees health insurance, but they can't do it right now because it's too expensive for them or their employees to pay for it.
All right. Congresswoman, thank you very much.
It's good to be with you. Thanks, Neil.
Well, meanwhile,